Top United States think tank sees no gauge of success in PH drug war. There appears to be a lack of evaluation by the administration of Philippine President Rodrigo Duterte of the effectiveness, or harm, of his bloody campaign against drugs, even if it has led to unprecedented numbers of surrenders or slain suspects, according to a leading American think tank. RAND Corporation, in a 2019 report titled Contemporary Asian Drug Policy, Insights and Opportunities for Change, set the case of the Philippines' campaign against illegal drugs was notable in its harshness but was hazy in its objectives. Although Duterte had repeatedly said he wanted to slay what he said was the Philippine drug monster and repeatedly affirmed his belief that drug users were beyond redemption. Duterte once stated that if Hitler had killed 6 million Jews, he'd be happy to kill 3 million drug addicts and pushers in the Philippines. He later apologized to Jews for that comment. It is unclear what consideration has been made to measures of success or to the opportunity costs of utilizing scarce public security and health resources, said the 118-page report section on the Philippines. There seems to be no official effort to evaluate these policies in terms of their effectiveness or harm caused, said the report of RAND, a non-profit research group based in Santa Monica, California's active, being funded by the United States government and private donors. Throughout Asia and the rest of the world, the report said, killing suspects was already found to be a failed approach to reducing or ending the drug trade. Extrajudicial killings of illicit drug users and low-level sellers are forbidden under multiple international conventions, the RAND report said. This is a particularly dubious approach for improving health and safety outcomes and could have unintended consequences, it said. One of the unintended consequences, the report said, is to drive addicts to further bury themselves in anonymity instead of seeking treatment if their addiction has become a health issue. This could defeat any anti-drug campaign if its purpose was to reduce drug use. Empirical in the Philippines, the report said dragnets and extrajudicial killings by vigilante groups and law enforcement have gone on since May 2016. It said while some other countries emulated the Philippine example in fighting drugs, like Bangladesh where 200 have been killed recently in anti-drug raids, there is no empirical basis for their effectiveness in reducing the drug problem. Duterte has repeatedly defended his order for police to shoot suspects, saying he was clear about it. Instructions that lethal force should be applied in cases of suspects violently resisting arrest or putting police lives in danger. In some instances, however, he was categorical about wanting drug suspects killed and at one time said he would feed their bodies to fish in Manila Bay. Duterte administration officials attest to the effectivity of the Philippine President's brutal approach in fighting drugs and crimes. However, in data on crimes nationwide, the Philippine National Police, PNP, set crime volume in 2016, the year that Duterte assumed office, fell by more than 12% and fell by a further 6.17% by 2017, or 490,393 fewer crimes. The PNP data appear to give credence to Duterte's theory that drugs and criminality are linked and a crackdown on drugs ultimately translates to fewer crimes. The RAND report said while there was intense focus on large-scale sweeps of mostly urban poor Philippine communities for drug users and pushers, the Philippine government's capacity to attack the problem as a health concern was limited, if not non-existent. This approach could be more effective in cutting down drug use. Citing as an example the mass surrender of hundreds of thousands of drug suspects in the Philippines, immediately following Duterte's rise to power. The RAND report said these individuals were just made to sign statements admitting drug use. They were screened for their level of need, but it wasn't clear how many individuals were appropriately screened given the lack of accredited physicians qualified for drug abuse screening in the Philippines, the report said, citing Amnesty International data. 10 classes it said most rehab programs being offered to those who surrendered were often out of sync with drug-related needs. Citing former Philippine Health Secretary Pauline Ubiel, the report said only about 1% of those who surrendered actually needed rehab confinement. Treatment resources are strained in the country, said the RAND report. When Duterte's war on drugs started in 2016, The Philippines had only 50 rehab centers with a capacity of 5,000 beds, the report said. In late 2016, 10,000 beds were added through a facility donated by a Chinese businessman in Nueva Ecija. The health system was cost-blasted, the report said, citing former health chief Dubious. Government-provided treatment is severely underfunded and overwhelmed, said the RAND report. Government facilities, it said, have been criticized for lack of evidence-based medicine drug addiction treatment. Most drug users are referred to unevaluated community-based rehabilitation programs, the report said. Thousands of suspects arrested during large-scale sweeps, according to the report, only shines a spotlight on the Philippines' broken prison system. The Philippine prison system exceeded capacity prior to the crackdown, the report said. But when the war on drugs started, the problem got worse. In the first year alone of Duterte's war on drugs, the number of prisoners saw a 22% increase to nearly 140,000. Government data shows Philippine prisons exceeded capacity by a factor of 5.5. Drug offenders accounted for at least 62% of total inmates. Prisons were bursting at the seams, but delay in judicial processes appeared to be aggravating the overcapacity. Of 84,000 inmates jailed for drug offenses, only 290 have been sentenced, the report said. The rest languish in detention awaiting trial, with some inmates spending up to 10 years in jail before either conviction or acquittal. No jailing tuberculosis. The RAND report said the numbers are staggering in terms of arrests for surrenders, which could further bring Philippine jails to dangerous levels of overcrowding. From July 2016 to June 2018, government data shows the PNP had arrested nearly 150,000 individuals, and more than 1 million people had surrendered. Police conducted 92,000 anti-drug operations between July 2016 and May 2018, leading to more than 4,000 suspects killed. Majority of those killed were poor residents of urban centers. The Philippine government reported 6,558 patients completing inpatient rehab programs, and nearly 160,000 of those who surrendered taking part in community-based outpatient programs. But the RAND report expressed doubt these could be considered measurements of success in the Philippine war on drugs. Generally, community-based programs in the Philippines are reserved for individuals with mild substance use disorder, the RAND report said. They are locally administered programs that consist of community service, recreation, counseling and spiritual formation, it said. We are not aware of any formal evaluations of the impact of such strategies on drug suppliers in general or in the Philippines specifically, said the report. Although there have been studies of drug law enforcement in other regions, the studies have not focused on extrajudicial killings or large-scale knot and plea sweeps, it added. Substantial costs as a policy, the Philippine crackdown has not been evaluated to determine what impact it has had on drug dealing or use, said the report. On its list of recommendations for Asian governments, including the Philippines, to more effectively fight the drug trade, RAND Corporation said governments and regional organizations should first improve data collection to produce more accurate and more reliable estimates of drug consumption and expenditures. Policymakers and governments should expand evidence-based drug treatment, it continued. Shareholders should monitor and project the implication of shifting patterns in synthetic drug supply, it said. Thank you for watching. Please subscribe.